Let's start with the future. Depending on how you look at it, the future is something you're either building towards or away from. Resiliélle believes in the future. This isn't about shareholders or trends or popularity. It's about the future. But the future is a risk because at some point, the present is going to push back and challenge you to fit in or fight. Resiliélle believes in the future and that the future is here to fight the status quo. And while it's always been about having best-in-class science with products and processes that restore skin better than anyone else, it's also about restoring confidence. Confidence in the exosome segment of the beauty market, the products available, what they deliver, and in doing so, revitalize the entire category. We're talking about a wholesale reset. The expectations, the promises, the delivery on those promises, and ultimately, the value to our shareholders and users. My name is Erin Crowley. I'm the CEO of Resiliélle and am myself a product of that kind of reset. My background and career in quality engineering has been all about quality manufacturing and exceeding international standards. So while it may be surprising to see a quality engineer and lead auditor at the helm of a cosmetic company, it really shouldn't be. We're a manufacturing brand with quality at the heart and soul of our business. That's part of the reset. Another critical and necessary reset is the category itself, to redefine the building blocks and expectations of what we consider best-in-class products. The conversation around exosomes in the US is almost non-existent. So when we talk about them, for a lot of people, it's the first time they've heard anything about them. That's why testing them and communicating both the safety and reliability of our products is integral with a healthy relationship with our customers. Only the best tissue harvested from low-passage Wharton's jelly stem cells, accompanied by FDA-compliant testing, is and should be the future by which all international standards are set, standards which all medical professionals should demand. Physicians, estheticians, you should be demanding these standards. We will continue to redefine the category with our AGE ZERO exosomes. AGE ZERO exosomes will be the bar and standard for efficacy, safety, and potency. Our process for harvesting exosomes and the scientific validation that guides us will expose, dispose of, and replace pretenders who risk making patients, doctors, and the category itself look bad. Currently, the exosome landscape consists of companies that are able to produce 10 million stem cells and a few billion exosomes at a time of a single quarter lot. They're making copies of exosomes, freeze-drying exosomes, or selling things like plant-derived exosomes, none of which live up to any set of standards that we would adhere to and make it understandable why this category can easily be written off as snake oil. So, since you really need about 100 million stem cells to adequately test the efficacy of them, we've created a technology that will allow us to extract between 7 to 10 billion stem cells at a time, ensuring that we're both the world's most extensively tested and most powerful exosomes. And yes, you bet we're in the process of patenting that. In a world that's sometimes all too willing to sacrifice what's right for what's easy, revitalizing a sense of hope is an act of rebellion. The future reminds us to keep building forward, and it should restore our belief in what's possible. Because the future isn't meant to be more of the same or business as usual. It's an invitation to a new age, to reset, And for us, that starts now with Resiliélle AGE ZERO. We may be newcomers to the cosmetic industry, but we're not new when it comes to the biotech or stem cell industry. When I started Resiliélle with my father, he came at it from a law perspective, and I came at it from the perspective of a quality engineer. We knew that in order to work within this space, we needed a series of systems that the science we had access to could grow within. A reset. To ensure that quality, we've been fortunate enough to be joined by Dr. Michael Heke and Dr. Corinne Cicchetti.
Hello, my name is Dr. Michael Heke, and I'm the Chief Science Officer for AT Venture Center and all its subsidiaries, including Resiliélle. So my background is in stem cell biology. I started doing stem cell research well over 20 years ago, and at first I was interested in very basic research about stem cells, and soon became more keen to actually focus on the potential of clinical translation. Today I want to talk about a little bit that came to my surprise, that we actually transgressed even into cosmetics and aesthetics. So I have the tremendous honor to be bookended by two amazing women, our CEO, Erin Crowley, who just presented a little bit about the mission of our company, and I will hand it over a little later to our Chief Medical Officer, Dr. Corinne Cicchetti, who will actually close out by showing you some results of a preliminary study that we entertained, and we have great results achieved with that. As I said, I want to tell you a little bit about exosomes, and exosomes are, as probably most of you know, are nano-sized extracellular vesicles that are secreted by most cells. Virtually all cells do that, and they're experts in intercellular communication, cell-cell signaling, and they have a particular capacity to actually modify immune responses and to trigger tissue repair, which makes them so interesting for cosmetic application. Also in particular for applications that are topical, that address skin issues. So other than typical remedies like moisturizer, for instance, they help the skin, but only as long as you keep moisturizing. So if you, for instance, have dry skin, you keep moisturizing, the skin looks great, but once you actually stop using the moisturizer, the skin gets dry again. On the contrary, when you utilize exosomes for more systemic application, you actually achieve physiological changes for the skin texture. So they are able to mediate tissue regeneration and rejuvenation even, afford you a more lasting effect through these treatments. Exosomes are experts in cell-cell signaling and cell communication in general, and as such they have a variety of roles. As you can see here, there are listed a few of the hallmarks of exosomes, and you will also notice that there are a few that actually not necessarily desired, like triggering metastatic responses, or apoptosis, which is also not desired when we are talking about rejuvenating our skin. So it's very important to carefully consider what kind of exosomes you are actually using. So the first thing you actually have to ask yourself, if virtually all cells secrete exosomes, what kind of cells do you want to use for our applications? And the answer is relatively simple. You want to use stem cells because stem cells are the building blocks of life, and therefore they're most suited to actually use them as a source for our exosomes in cosmetics and aesthetics. Here's like a brief overview of the kind of stem cells that you can have, and above the dotted line you see the most potent of them all. There are our famous or infamous embryonic stem cells that are considered the most potent because they can differentiate virtually all cell types. And there are also iPS cells. Those are reprogrammed somatic cells that are very similar to ESCs without the ethical controversy that's inherent to them. Even though they are the most potent stem cells that you can find, they are no longer considered suitable for any kind of applications, however. One reason is certainly the ethical controversy that surrounds embryonic stem cells in particular, but there's also an issue with them potentially causing teratomas. So these are benign cancers that can be triggered by pluripotent stem cells just because they are so potent that they're hard to control. So what you want to use is multipotent stem cells, like tissue-derived stem cells or progenitor cells. These are typically have their applications in regenerative medicine and beyond, and those are the ones that we want to focus on as well. Among those tissue-derived stem cells, we are focusing on mesenchymal stem cells, and for a particular reason. They are inherently immunoprivileged, so they lack certain surface markers that would potentially cause rejection by the recipient, and they are therefore the most suitable stem cells we can use for any given application. And for these mesenchymal stem cells, we have a number of potential sources as well. Here at the bottom, you see bone marrow and adipose tissue. They are considered less potent, and I will tell you in a moment why that is. And then you have the three areas on top. They are perinatal tissue-derived stem cells or mesenchymal stem cells that are more suited to what we try to accomplish. And among them, we're utilizing, personally, the umbilical cord-derived mesenchymal stem cells derived from the Wharton's jelly, because even within the perinatal tissues, there are differences. And the Wharton's jelly is not only known to feature an abundance of mesenchymal stem cells, but they're also having a property that we call AGE ZERO, which is very important of what we're trying to achieve, and I will tell you in just a moment what that actually means. There's a variety of potential sources for stem cells, but we are definitely focusing on Wharton's jelly stem cells, mesenchymal stem cells, and exosomes derived from that, because they are the most potent cell that we can think of. When we do harvest those mesenchymal stem cells, we observe a strict policy of low passage. That means we cannot passage them more than 4 times. 4 times means it's basically a recommendation by the International Society of Stem Cell Research, and it is postulated as a threshold that after 4 passages of your cells, meaning the length of cultivation, culturing to expand them, after those 4 passages, you can be reasonably sure that you still have the exact kind of cell that you harvested originally. So the longer you culture them, the higher the risk for transdifferentiation is, or for contaminations and even mutations, something that you definitely want to avoid. This is just like a picture from our umbilical cord, and you see that there's a number of potential sources for mesenchymal stem cells, and the Wharton's jelly is the one that we focus on because they feature low immunogenicity, and it's an easy harvesting procedure and in vitro amplification, and as I said, they are zero-aged. Now, zero-aged, I mentioned that a few times, and here's a slide that depicts why it's so important. You see how dramatically our stem cells decrease in our bodies once we are born. So a newborn has an abundance of circulating stem cells, and then you see within the first decade, you only have like a quarter left, and then it further deteriorates. But not only that, you also, during your lifetime, you are subjected to environmental hazards like toxins, things in your food. All of them can actually diminish the quality of your stem cells. So if you have bone marrow or adipose tissue-derived stem cells from a healthy 20-year-old, you would think they are in the peak of their lives, and therefore it is a good, suitable source for stem cells. But even a 20-year-old has been subjected to 20 years of environmental hazards, and has gone through diseases, etc. So the stem cells are not quite what they used to be. Furthermore, there is a very important time in our lives, which is the time that we are born. And the reason why it's so important in this context is that there's a dramatic change happening. So before we are born, while we are developing in utero, there we feature like the absolute and unlimited potential for regeneration and repair. This is soon lost or immediately lost once we are born, because development is considered to be completed, and then it's just aging and growing. So it's no longer considered to be needed by the body. That is unfortunate, because we are not only losing the absolute capacity for total repair, but with age, as we all know, it further deteriorates, and regeneration takes always longer, is not as complete or as sufficient as it should be. So we want to harness that capacity of total repair and regeneration potential, and this is what we describe as zero-aged. So the mesenchymal stem cells that we harvest from the umbilical cord, they are created before the baby was born, so therefore they do have this capacity for total regeneration and repair still. And this is what we harness even for applications in aesthetics to achieve rejuvenation. So therefore it's so important to actually harvest the right amount, the right kind of stem cells that are zero-aged, and not to extend cultivation of those cells for the benefit of getting as many cells as possible, so that we retain this zero-age characteristic that has all those benefits. And this is how we actually do it. So all our cells are coming quality assured, and they're ethically derived from healthy births within the US. They typically come from C-sections to avoid any contaminations, birth-related contaminations by natural births. And the donors are followed up to 6 months prior to giving birth for their suitability. Then we collect those umbilical cords, and they get processed, and we harvest those cells. And at the end of our cultivation, we actually submit our cells to a CLIA lab for third-party unbiased testing against pathogens, and we do extensive validation and characterization of our cells and also of our exosomes derived from them. So I talked a lot about stem cells and less so exosomes, but this is actually the most important part, that you source your exosomes in the right way, that you utilize the most suitable source for them, cell source, and the most potent one, because only then you actually benefit from the potential that exosomes have towards our applications. So this constitutes the Resiliélle difference. We are able to achieve a leap back in time with our AGE ZERO exosomes. That has been shown in applications, for instance, hair rejuvenation, where a middle-aged man noticed thinning hair on top of his head, and after just one treatment, 4 weeks later, we could see that there was more hair, that it was denser. But not only that, it was not only denser, but the patch that regrew denser was overall also darker. Given his age, being in the mid-40s, already had salt and pepper kind of hair, and where it actually regrew and rejuvenated, the hair was overall darker, clearly indicating that we actually can revert and go back in time. Another case was somebody with a bald spot of considerable size for over 3 decades, and it took a few more treatments to see a significant effect, but we noticed that the bald spot became smaller. Just like when it starts, you start out with a small bald spot and then it grows in size, and for this treatment it reverted back. So the bald spot became smaller and smaller, and with fuzzy hair in the middle as well. So all of our results indicate that we can achieve serious rejuvenation with AGE ZERO exosomes, but with AGE ZERO exosomes only. I mentioned that we have a CLIA lab certificate and of analysis and conformity with every batch of our cells. It's some 20 plus pages that gives you assurance of perfect quality and potency. We obviously use xeno-free and serum-free media for our cultivation, and our exosomes, also very important, and I cannot stress that enough, are never lyophilized. So a lot of other providers, let's say, lyophilize their exosomes for the benefit of longer shelf life. That sounds great, but unfortunately, exosomes are biologically active. If you freeze dry them, you actually destroy them per se. So we actually have checked on competitors' exosomes and reconstituted them, and we did not find a single exosome that was intact. So what you end up with is exosome junk that might do something good, because there might be a few growth factors that are retaining their properties, but overall you basically destroy them. It's I always like to say it's like freeze drying a steak, and then you pour some water over it and try to eat it, and with delight. It's not going to happen. And last not least, we adhere to very stringent US FDA manufacturing standards. I mentioned that we are deeply rooted in regenerative medicine. So when we started out our business, we actually approached the FDA proactively and asked for advice how we should do things and what we have to observe to actually work with them and not against them or them against us. And that led to a great report. We exceeded their requirements based on things that we found also important. It just is testament to the excellent quality of our cells and the exosomes that we derive from them. So before I hand over to Dr. Cicchetti, this is something that we actually pursue as applications in the field of aesthetics and cosmetics. So we look into options for exosomes therapy in conjunction with microneedling or after laser treatments, in particular with a focus on how it mitigates inflammation. Very important after these procedures that I just mentioned. We have seen great results in hair rejuvenation. We have also seen results in eczema, improving eczema, and improving the appearance of scars. Scars is like one of those interesting topics where it's in between dermatology and cosmetics, so it's in between aesthetics and medical applications, really, because it depends on the wording that you use. If you want to treat a scar, it's a medical application. If you want to improve the appearance of a scar, it is a cosmetic application or aesthetics, even though it might be the same thing. I mentioned earlier that we are deeply rooted in regenerative medicine, and all our exosomes are actually having the quality of being applied in either. They have medical grade of superior quality and potency. And I hope I was able to convey to you during my presentation why that is and why we firmly believe those to be the best and most potent, best quality exosomes in the market. And with this, I hand over to our Chief Medical Officer, Dr. Cicchetti, who tells you a little bit more about the results we've been able to accomplish so far.
Hello, my name is Dr. Corinne Cicchetti, and I am the Chief Medical Officer for Resiliélle Cosmetics. I'm here today to talk to you a little bit about myself, about how I became affiliated with Resiliélle Cosmetics, and more importantly, about the groundbreaking research study that we just did using exosomes. So I am a board-certified physician in the area of rehabilitation medicine, and I have been practicing for the last 15 years. About 9 years ago, I really got more involved with regenerative medicine, and that involved mainly PRP and stem cell therapy, and I was really seeing amazing results with my patients. So I decided more recently to open up a second practice with a focus on regenerative medicine, as well as aesthetics, which has become another one of my passions. So my first introduction to exosomes was actually because I began using microneedling as well as radiofrequency microneedling in my aesthetic practice, and was using topical exosomes that were available from another company to help promote healing and minimize downtime. Over the pandemic, a lot of the labs that produced Wharton's jelly stem cells were actually shut down by the FDA for a number of reasons, mostly because they were not compliant with FDA regulations. It was very important to me that I had high quality cells from a clean lab and to also have full transparency from the company. At that point, I did a large search to try to find another company, which was very difficult at that point. And I met with Erin Crowley, as well as her father, Mike Crowley, and I was very impressed with them as well as their product, and I decided to start using their products right away. Exosomes over the last couple years have exploded onto the market. There are several different companies with different doses and different sources, all making claims that they are the best out there. Some are from Wharton's jelly, some are from adipose tissue, and it's hard to know as a consumer which is the best. I personally was not happy with the exosomes that I was using. I was getting results from them, but I did not care for the consistency of the product, and I did not care for the scent. The product that I was using was also lyophilized, and I questioned the viability of the exosomes in that product. So when I was able to actually get exosomes from Resiliélle, they were Wharton's jelly, AGE ZERO exosomes in saline. They were easy to use, and I still got amazing results. So I immediately switched over to solely using Resiliélle exosomes. So as a physician, the things that were important to me were, number one, I want to use the best-in-class exosomes. I want to be sure that the exosomes have adequate quality testing. They obviously need to be easy to use and easy to store in my office. I was looking for full transparency from the company as well as a reasonable price point. Resiliélle met all of the above requirements. They also had multiple doses, 5 billion, 10 billion, 50 billion, 100 billion, so I could use whatever dose that I want. However, that leads us to the question, how many exosomes do we really need to get a superior outcome? Nobody has ever really looked at this. We do know that microneedling is a highly effective procedure. It has been studied in the literature. And we know that using topical exosomes do minimize downtime, and they improve the outcome of the treatment through a variety of ways. But there's never really been a study to quantify the number of exosomes that are needed. And really, the doses from all the other companies seem to be arbitrary. They are all over the place. So we set out to collaborate on the first ever study assessing topical exosome dosing combined with microneedling. And I became the principal investigator for this study. So our study design was fairly simple. We used women ages 35 to 60 years of age initially. Over time, we did include some male participants as well, but primarily it was women. We used the skin pen, which I have at my office, and subsequently we also included the Rejuva pen. Many offices do not have the skin pen, but Rejuva pen is also an FDA-approved device. So we did mandate that any clinics that participated in our study use one of those two devices. Patients were scheduled for 3 treatments about 4 weeks apart, and they were randomized to one of 3 groups, a 5 billion, a 50 billion, and a 100 billion group. Now, it is important to know that we did not have a control group for the study. We did not have an only microneedling group. We know that the microneedling already is effective, and it's been shown in the literature that exosomes do help with wound healing of the skin, and that's essentially what we're doing with microneedling. We're creating a wound to the skin, a controlled wound, and the exosomes are used to then heal. So we are really assessing the difference between the exosome groups, not the effectiveness of the microneedling itself. So we had questionnaires to be filled out at each visit when patients came in, and then they were also to fill out questionnaires at 72 hours post-treatment. Final results are at 6 months from their first treatment, and at that point we would take final pictures to assess their outcome and do a final questionnaire. Our exclusion criteria really are the exclusion criteria for general microneedling. There are no exclusion criteria for topical exosomes themselves, so this would be criteria for just the microneedling. So that would include having active skin cancer in the treatment area, having open wounds, sores, or irritated skin, have an allergy to stainless steel or an anesthetic, as we do numb the skin prior to the procedure, have a bleeding disorder, are pregnant or nursing, or are taking a drug such as Accutane. So the study commenced at my office, Buffalo Regenerative Medicine and Aesthetics, and we subsequently opened it up to other practices that wanted to participate. So we now have a total of 5 practices with a total of 98 participants. We started in May of this year, and so we are yet to obtain all of our 6-month data, as it will be coming in actually this month. We plan to have all of our final pictures reviewed by an independent dermatologist for further analysis as well. So we do have some preliminary results to share with you. And these results are really lumped results from all the groups because we do not have that 6-month final data. It is hard to really show you the results between the 3 treatment groups. So we are just showing you the effect of all of the groups together. 84% of patients noted improvement of skin texture. Now, we would normally see some improvement of skin texture with just standard microneedling without exosomes, but 84% of patients noting improvement of skin texture is actually quite high. And improvement of skin firmness, 88% of patients noted this. This is not something we would typically see with standard microneedling, so we were very surprised to see this result. We also asked patients about improvement of skin radiance, and about 80% of patients noted improvement of radiance of their skin. Being in aesthetics, hyperpigmentation is one of the most difficult things to treat. However, 70% of patients actually noted improvement of hyperpigmentation after their treatments. 77.3% of patients noted improvement of wrinkles and fine lines, which is also wonderful results. We do typically see some improvement with fine lines from standard microneedling, but in terms of wrinkles and this high percentage, this is a phenomenal result. We also asked them about improvement of visible pores, so a decrease in pore size, and 68% of patients noted a decrease in visible pores. We also asked patients if they felt that the exosome treatment improved their skin quality and appearance after their 3rd treatment. And an overwhelming 77% of patients noted that they did have improvement of quality and appearance. And we also asked them if they felt that the treatment increased their self-esteem as a result of the treatment, and 63% said yes. We also assessed redness reduction in this study. So we asked patients on a scale from 1 to 5 if their speed of redness reduction using Resiliélle exosomes was improved compared to microneedling without exosomes. And a fair number of our patients had had standard microneedling previously without exosomes. So we were able to obtain some good data from this. We know that using standard microneedling, patients will note redness for 48 to 72 hours after procedure. And you can see here that many of our patients noted a significant reduction in the amount of time that they had redness after the procedure. And I will tell you that some patients reported a decrease in redness within 4 hours after their procedure, with the majority stating that their redness decreased within the first 24 hours. So let's look at testimonies. So I will tell you that overwhelmingly, my patients in our practice had great results and were raving about their results to us. And these were testimonies that they actually wrote, not to me, but they wrote on the questionnaires. So this is a 51-year-old woman who stated that my overall appearance of my skin with makeup and without has me loving my skin. One of my main goals was to be able to wear makeup and feel comfortable doing so, maybe only with a tinted moisturizer. This is amazing. This patient, who is 41, said, I loved this treatment and have seen a noticeable difference in my skin. I look more radiant, younger, and well-rested, even when I'm not. I've needed less makeup since starting this treatment, and I've received several compliments from friends and family as well. And this patient, who's 35, said, after the first treatment, I saw a big improvement in the texture and brightness of my skin. For the first time in my life, I left my house without makeup. That's an amazing testimony. We do have some before and after photos to share with you. A couple patients who have completed all 3 treatments here. This patient is the same patient in both of these pictures. Pre-treatment is to the left and post-treatment is to the right. You can see to the left that she had a large area of hyperpigmentation down by her chin and her mouth, and you can see that reduction in hyperpigmentation very well in her post picture. Same thing on her forehead. She had a large area of hyperpigmentation due to melasma on her forehead, and that was significantly decreased post-treatment after the 3rd treatment. This patient here suffered from a great deal of acne scarring, and you can see from her first picture to her post-3rd treatment picture, she had a significant improvement of her scarring and overall skin texture. This patient as well completed 3 treatments. This is where you can start seeing that firmness of the skin. You can see that it actually looks like her cheek has lifted, her lines are better, her texture is better, and she also had a decrease in that hyperpigmentation as well on her skin. These 2 patients were pictures after their second treatment, but you can see the patient on the left, she has had an overall improvement of texture as well as improvement of firmness of her skin as well, with less visibility of those fine lines, particularly around her mouth. And same thing with the patient on the right. You can see her overall texture and appearance of her skin is improved. These are the results that we have thus far for the study. We obviously will be getting a lot more information in the coming months, and we are excited to share those with you once those results have been analyzed, and we do have our dermatologist review those pictures. We are very excited to move forward with sharing all of those results with you and with the public. I personally have used these exosomes on myself, on my family members, and have used them on hundreds of patients in my clinic, and I can't speak enough about the results that I am seeing from these exosomes. So I challenge all of you out there to also try using them in your practice. Thank you very much.
If you have any questions about Resiliélle or want to learn how you can be involved with clinical trials of our exosomes, you can contact us at resiliélle.com. If you're interested in purchasing our product for use in the UAE, please contact our exclusive UAE distributor at greatlookinc.com. Thank you for joining us.